What is the difference between a dural tear and a CSF leak? Now for this I'll have to tell you something about dura and CSF. So I am Dr. Gurneet Singh Sawhney. I am a functional neurosurgeon and consultant neurosurgeon at Fortis Hospital Mulund, Mumbai. Let me tell you about this dura and the CSF. Now CSF is the fluid, it's called cerebrospinal fluid, which is present in our brain and it is flowing throughout. It covers the brain, goes inside, goes into the ventricle, goes through the spinal cord, but doesn't come out of the brain because the brain is covered on all sides by something called as dura, a dura matter. Now dura means stuff and matter means mother. So dura matter is a tough mother of the brain. Now whenever there is any cut in the dura, this CSF comes out from that cut and that gives rise to a CSF leak. Mostly we have this leaks happening after an injury or trauma or surgery, but in some of them we have it spontaneously. Spontaneously ये leaks जब होते हैं, so there will be CSF rhinorrhea, that means CSF coming out from the nose is called the CSF rhinorrhea. CSF otorrhea, matlab CSF coming out from the ear. Now in this we need to find out where is this dural tear, और ये कैसे find out करेंगे? By doing something called as a myelogram, which is an CT scan where we give an injection in the spine in the fluid area and we see where does it go. Once we find out the place of that tear, we repair it. Now repairing can be surgically, it will be surgically. Now how are we going to do that? We do it mostly endoscopically if it is from the nose. So CSF rhinorrhea is treated from the nose and endoscopically also from the ear. If it is too big a tear or leak बहुत ज़्यादा है, then we have to do a craniotomy or a surgery from the top and we close that leak. The risk of keeping the leak or the CSF coming out is infection. So patient can have brain infection, so which we don't want. So the leak or the dural tears have to be treated and treated completely. We have to make it watertight, which is easily doable. It's a common procedure. So we don't need to worry about the dural tears or the CSF leak. It can get cured and treated. Thank you.